Hello,
Good morning.
very good morning to everybody.
Yeah, thank you.
I am audible and
Yeah,
visible.
yeah, yeah, yeah.
Okay, thank you.
Connected now. And how to share
Mr. Harshit. Dr. Kamath, very good morning.
Very good morning. I'm Dr. Kamath.
Kamath sir, namaskar.
Namaskar, namaskar.
Pathak sir, namaskar.
Namaskar. Good morning, everybody.
अनिल सर नमस्कार. हाँ आ रही नहीं सर, इसमें नहीं आ रही आपका. आई थिंक कंप्यूटर सिस्टम से आ रही है, वो चेक कर लीजिएगा आपका स्पीकर जो है.
अभी आ रही है? अभी आ रही
अभी आ
है?
रही है सर, अभी आ रही है, अभी आ रही है.
ठीक है. ये एक वेबिनार शुरू हो रहा है, तो Dr. Kamath, good morning.
Yeah, good morning, good morning.
How are you? Good to see you after a long
fine.
time.
Yeah, I wish you happy new year.
Same to you.
Thanks. Thank you, thank you.
We met exactly 1 year before. Huh?
Yeah.
It is complete 1 year.
Yeah, almost.
And Dr. Pathak sir, Professor Pathak sir.
Namaskar. Good morning.
Good morning. Good morning. Good to see you, Pathak sir, and thank you for joining. Ji.
Thanks for your invitation and happy New Year to everybody.
Ji, happy New Year, sir. And we are waiting our colleague from Kerala to join.
Okay.
Mr. Shekhar, he is getting some problem. So once he joins, we will immediately start.
Yeah. Okay.
Right. Okay.
We already have around 70 participants by this time, and others are also joining. So, yeah. And my colleague Atisha Sood is here. Atisha, you put on your video so people can see. Atisha is working with the WHO project with us. And Shri Ashish Pandaji is my colleague. He's a faculty colleague. He is also in my division. And Harshit is my young professional. Atisha, you introduce yourself.
Good morning, everyone. I'm Atisha Sood. I'm working as a research fellow in the Health Adaptation and Resilience Project, supported by WHO India.
Good morning, Atisha ji. Hope you recall me. We met in Vardhaman Medical College.
Yes, sir. Yes, sir. Good morning, sir.
Yes.
हर्षित क्या हुआ शेखर का?
Sir, Shekhar sir is joining. He'll be added as a panelist by Harshit manually because you got to add it.
Acha. So should we wait for 2 minutes?
Yes, sir. Let's just wait for 2 minutes and we'll begin.
ठीक. And इसका live है. This is also going live on YouTube, na?
Yes, sir.
So this is going live on YouTube also. जी.
Professor Gupta ji, I am really thankful to you and want to congratulate you also for taking initiative on a very important issue which our country is facing.
जी जी, थैंक यू सर, थैंक यू सर।
ऐसे समय में आपका ये जो प्रयास है ये रियली
जी
मैं इसको बहुत अप्रिशिएट करता हूँ। और ऐसी हमें वेबिनार और इंस्टीट्यूट जो गवर्नमेंट इंस्टीट्यूट्स हैं, जैसा
जी
कल हमारे
जी
माननीय मंत्री जी भी कह रहे थे कि वो होनी
जी जी
चाहिए
जी
अवेयरनेस
जी,
प्रोग्राम। यस।
बिल्कुल बिल्कुल सर, एंड वी आर थैंकफुल फॉर यू फॉर योर सपोर्ट। जी जी, सबके सपोर्ट, आप सबका
हाँ
सपोर्ट हमारे
हाँ
लिए बहुत
हाँ,
इम्पोर्टेंट
जी
है।
हाँ
जी
जी
जी,
हाँ जी हाँ।
क्योंकि अभी हम देख रहे हैं कि सब नए टाइप के डिजास्टर्स ज्यादा हो रहे हैं। जो कन्वेंशनल डिजास्टर्स है 2000
हाँ हाँ, जो आप पहले जिनके लिए प्रोग्राम बनाते थे डिसास्टर
जी
मैनेजमेंट के, और आपको अपनी स्ट्रेटजी बदलनी पड़ रही है।
बिल्कुल बिल्कुल, आप देखिए सारे 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 डिजास्टर्स जो है वो तो हो ही रहे हैं, फ्लड्स, ड्राउट, वो तो है ही।
राइट
लेकिन ये भी इन्वायरमेंटल इमरजेंसीज वाले जो डिजास्टर्स हैं वो ज्यादा हैं। जो
ज्यादा है।
हाँ, जो हेल्थ इमरजेंसी, इन्वायरमेंटल
यस
इमरजेंसीज,
जी।
पैथोजेंस, पेस्ट अटैक, इस बार देखिए जो जो लोकस अटैक भी इतना भयंकर था।
यस हाँ, वो भी बहुत ज्यादा था। यस यस।
हाँ, तो ये बिल्कुल चीजें हैं जो अभी आ रही हैं। और कोविड पीरियड में तो खैर इतने तरीके की कॉम्प्लेक्स इमरजेंसीज पैदा हुई।
जी। एक्चुअली मेरा तो ये मानना है कि अगर टाइमली थोड़ा अवेयरनेस लोगों में, और थोड़ा जो ये जो सोशल मीडिया है ना, यहाँ बहुत
जी
सारी र्यूमर्स बहुत लोग स्प्रेड
हाँ,
करते
उसमें
हैं,
उसमें फिर कंफ्यूजन ज्यादा हो जाता है। जी जी
ज्यादा हो जाता है। तो हमारी साइंटिफिक कम्युनिटी का रोल ज्यादा हो जाता है कि हम उन र्यूमर्स
जी
को, वी शुड कंट्राडिक्ट ऑल दीज र्यूमर्स, और
जी जी जी,
लोगों को सही बात बताई जाए।
बिल्कुल 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 बिल्कुल।
वो भी मेरे विचार से डिजास्टर मैनेजमेंट का एक पार्ट है, टू
बिल्कुल
टू टेल द पीपल द राइट थिंग, सो दैट दे
एग्जैक्टली
शुड नॉट, हाँ, ताकि वो लोग
अभी
पीड़ित
देखिए
नहीं हो।
अभी देखिए व्हाट्सएप का भी जो हो रहा है वो भी एक नए तरीके का डिजास्टर है।
हाँ, वो भी है। यस यस यस।
हाँ, all these are basically the situation, हाँ हाँ, the situation where community cannot cope up, है ना?
यस,
हाँ
बिल्कुल
हाँ, that
बिल्कुल,
is some kind of disaster only। जी जी
डेफिनेटली।
हाँ।
Sir, Shekhar sir is here. I think we can begin.
Hi Shekhar, welcome,
Namaste,
good
Anil
morning।
sir. Good morning. Sorry,
Namaste।
there was some glitch in
हाँ,
the.
no worries, but it is good to see you after long time। Yeah, but we are not able to, yes, now we can see you Shekhar। हाँ,
शेखर जी नमस्कार।
so
Namaste.
always fit and smart as always। Good, good. So Harshit, now we can start।
Yes, sir. Yes,
We almost have 100 participants also, we should
yes,
start।
yes, sir. Hello, everyone. Hello, everyone, and welcome to our today's webinar on bird flu, a health emergency risk and response, which is being organized by the National Institute of Disaster Management, Ministry of Home Affairs, Government of India. I am Harshit Sharma, working in NIDM as a young professional under the supervision of Professor Anil Kumar Gupta sir, who is the head of ECDRM division NIDM. Our resource persons for today's webinar would be Professor Anil Kumar Gupta sir, head ECDRM division NIDM, Professor KML Pathak sir, former Deputy Director General ICAR and former Vice Chancellor DUBASU, Dr. Ramchandra Kamath sir, Professor and Head Department of Community Medicine, Kodagu Institute of Medical Sciences, Karnataka, Dr. Shekhar Lukos sir, who is the Member Secretary, Kerala State Disaster Management Authority, and Head Scientist State Emergency Operations Center, and Sri Ashish Kumar Panda sir, who is consultant faculty in NIDM. Ms. Atisha Sood, Research Fellow NIDM, is also the coordinator of the webinar. Now, moving ahead, first I invite Professor Anil Kumar Gupta sir for his welcome address after his brief introduction. Professor Anil Kumar Gupta sir, HOD CDRM and IDM, is a disaster mitigation and crisis management professional. Professor Gupta possesses interdisciplinary expertise with institutional development, coordinated several international national projects, over 100 academic publications, etc. He also served NMDC, DMI, NIRI, and SICON in administrative technical capacities. He is coordinator of Technical Advisory Committee of NIDM. and a member of governing council and academic research advisory of several institutions and high-level ministerial delegation abroad. Over to you, sir.
Thank you, Harshit, and thank you, Harshit, and a warm welcome to all the participants and all the expert resource persons of this very important and timely webinar. I compliment Mr. Harshit Sharma and Ms. Fatima and Atisa Sood for choosing this topic, as this emergency has already started, and we are into managing the situation and looking to that it should not become a major disaster. On my personal behalf and on behalf of the executive director of our institute, Major General Manoj Kumar Bindal, and all members of an NIDM faculty, welcome all the resource persons and participants. As we have started facing a wide diversity of disasters, and as we were informally discussing before we started this webinar formally, that now the trend and patterns of the disasters have changed drastically, along with the conventional type of disasters like floods, cyclone, earthquake, landslides, drought. Yes, all those disasters are already occurring. But besides that, a number of environmental emergencies are taking the form of disasters. And environmental emergencies are taking the form of
Sir, your audio is not clear. Atisa ma'am?
I'm checking.
ये इसमें एक बार कंप्यूटर वाले को बुला दीजिए, वो गड़बड़ हो जाता है, उससे वो हिल जा रहा था, सुबह भी हुआ था. ठीक है. Am I audible now? I'm sorry for some. Harshit, am I audible?
Yes, sir. Now you are audible, sir.
Yes.
Yeah. There was a little connection disturbance. हाँ. बेटा ये हिल जा रहा है, उसमें आप ला करके लगाइए अभी. So I was referring to that a number of environmental emergencies are taking the form of disaster through the route of health risk and health emergencies. So, and that has been a lesson in coronavirus pandemic also, because that also started from the wild genes and then human intrusion to that, and then it took the form of the health emergencies initially, and then it became a global disaster. And in the bird flu case also, which is not new, because almost every year in some or other part of the world we are facing the menace of bird flu, and the strain H5N1 is not uncommon to India also. In the past also we have been facing this menace, but this time almost 8 states are being affected by this, and there may also be a risk that it can cover a wider geographical area, and there are two special dimensions which make the very more serious. That is, the pneumonia is again one of the common between this and corona. But what are the impacts of corona on human health? Here it can lead to multi-organ failure. So these kind of things are even making the impact of the risk of bird flu to humans, in case the human population is affected, more serious. But besides this, the equal or even more severe issues are for the economic the activities, like the entire animal husbandry and poultry, meat shops and businesses is also affected. ये दिख रहा है, मैं दिख रहा हूँ ना? नहीं,
Sir, your video is not visible, yes, sir.
अच्छा, ये यहाँ से 1 मिनट मैं करता हूँ।
क्या
अभी भी नहीं आया? हाँ, वो ठीक है।
क्या था भाई जहाँ से लगा ये हमें बोल रहा है ये इलेक्ट्रिसिटी हम
Hello, am I audible now?
Yes, sir. Yes, sir. You are
Yeah,
audible,
so
sir.
yeah, I'm using the seat of colleague Shri Ashish Pandaji as my system got little disturbance. So what I was referring to that the lessons of coronavirus pandemic and the kind of complex emergencies that we have faced during the past 10 months period also warns us that the impact of these kind of environmental and health emergencies to have a widespread implications. And the bird flu also makes us little more worried about the impact on economy. As if we look at the kind of a meat and poultry industry, already got lot of feedback during the coronavirus pandemic period also. So for one year, it had serious disruption, and now it was reviving. And with the bird flu, again there is a serious impact. But it is not only the animal meat industry, but it is also affecting the livelihood of a lot of people. It is also there is some background noise. Harshit, you can mute the other people. It is also a risk to biodiversity. It is also a risk to the tourism sector, because many of the national parks and sanctuaries, bird sanctuaries, have been closed. So lot of challenges to the livelihood and economies associated with these entrepreneurships. And I would also call that a systemic impact assessment on various aspects, like the environment and biodiversity, on health issues, on livelihood, on the economic interventions by people, would also need to be carried out, so that we can really understand that is something which looks like a very narrow kind of emergency, how it has a widespread impact. So today we have some experts from health sciences, some experts from animal sciences, and food security, and one of the expert colleague from our state government, Mr. Shekhar, who is dealing with disaster management from the governance side, and my colleague Mr. Ashish Panda. So we will have a kind of a multidisciplinary approach to today's discourse, that will help us understand that what are the key issues in dealing with this bird flu emergency in a more holistic way. So with this, I welcome each one of us, each one of the speaker, and each one of the participant once again. Over to you, Mr. Harshit.
Thank you very much, sir. Thank you very much for your welcome address and the opening remarks also. And now moving ahead to our first technical session of the webinar, I first invite Sri Ashish Kumar Panda, sir, who is the consultant faculty NIDM, after his brief introduction. Sri Ashish Kumar Panda sir, ECDRM division NIDM, is working in National Institute of Disaster Management, New Delhi as a consultant faculty. He is a Central Secretariat Service Officer and MBA in Disaster Management. He is pursuing PhD in climate change field. He has more than 6 years working experience in the Disaster Management Division of MHA. He joined NIDM as a faculty member in September 2019 and looking after the forestry, biodiversity and animal inclusive disaster risk reduction section of ECDRM division of NIDM presently. Over to you, sir.
Thank you, Harshit. Kindly allow me to share my presentation.
Yes, sir. Yes, sir. So you can share directly, sir. Click on the share button.
No, that option has not been given to me.
Okay, 1 minute, sir.
You have to allow him, Harshit.
Yes.
Yes, sir. Now you can share, sir.
Yeah, I'm trying.
Yeah.
Can you see the presentation full mode?
Yes.
Yes, sir. Yes, sir.
Okay, so thank you. Warm good morning to each and everybody present here. Stalwarts and experts are there in the field of bird flu. I am a novice in this field of disaster risk management in NIDM. Recently, I joined last year only. So thank you so much, Professor Anil, for giving me this opportunity to speak on this this kind of disaster, that is bird flu. As far as spread and panic is concerned, today's news is more than 10 states have shown positive results with respect to bird flu, that is also called avian influenza. States like Kerala, Rajasthan, Madhya Pradesh, Haryana, Himachal Pradesh, UP, Maharashtra, and now in Delhi also. Now, other states also which have been reporting deaths with respect to poultry, birds, including crows, migratory species, also going for tests. Tests are being done in the labs of Jalandhar, in the labs of Bhopal. As anxiety is spreading, that there is fear of fresh flu to the poultry industry, like rightly mentioned by Professor Anil, that economic impact of this bird flu is very, very grievous, and reports have been coming of people giving up chicken and eggs, and of prices beginning to fall like anything. This is a schematic diagram. Last 2 days back diagram is there. I mean, the red color of states you can see which have confirmed cases. Now this spread is more by today's standards. More than 10 states have reported positive. Then there are states with suspected cases. Their analysis is being done in these 2 labs of Jalandhar and Bhopal. And then ban has been imposed on poultry products from other states as well. As far as specifically Haryana state is concerned, 2 specific villages, Kheri and Ghanoli, they reported spread of this H5N1 virus, and a culling order has been given. That is the biggest culling order of birds in any state, to the tune of 1,66,000. That is taking place in the 1 kilometer area of these 2 villages, and also the 10 kilometer area of these 2 villages has been made surveillance zone, and the state government is also offering ₹90 per bird compensation to the owners whose birds are being culled. So prevent spread, the check posts have also been set up in Haryana in infected areas. The National Institute of High Security Animal Disease, that NIHSAD laboratory in Bhopal, where these tests are being done, they have confirmed that other than these 2 villages, the Panchkula area of this Haryana, that has been hugely infected with respect to this bird flu. More than 4.37 lakhs of poultry birds have died in these areas, especially the Barwala and Raipur Rani area, which is considered to be Asia's second largest poultry belt in last 1 month or so. Arrangements have been made at the community health center in Raipur Rani, and isolation wards have been set up where this Tamiflu and antiviral tablets have been procured to check human-to-human transmission of this influenza. As far as our Delhi and NCR is concerned, we got the reports of crow carcasses in areas of Mayur Vihar, Paschim Vihar, and areas like that, where samples were sent to Jalandhar and Bhopal. Now, today's news is that they have been tested positive with respect to H5N8 which is less pathogenic with respect to the threat of human spread. The chicken prices have crashed in our wholesale markets, especially the Gazipur. This chicken market has been closed for 10 days now. The packaged poultry meat has been banned in Delhi. As far as Delhi Zoo is concerned, if you remember distinctly, in the year 2016, we had this kind of situation where most of these specific exotic birds, they died in the Delhi Zoo. So I've had that kind of situation. Now SOPs are being followed. In the Delhi Zoo right now, enclosures are being disinfected thrice a day. Chicken not being ordered from Delhi NCR shops for wild animals that are being kept over there. And they're not keeping fish and bird feed in open enclosures so that the migratory birds which are roaming above the Delhi Zoo, they should be attracted to these areas. Hastinapur Sanctuary has been closed for registration for the future businesses in those areas. And also, this is a worrisome figure that Sanjay Lake, 400 ducks, they have been culled as per the government order and as per today's news. So if we talk about the types and classifications, this influenza is a highly contagious viral disease affecting several species of chickens, turkeys, quails, guinea flu, etc. It also affects the pet birds and wild birds and occasionally mammals, and sometimes in one strain also can migrate into the humans also from the poultry birds. Basically, there are three types: A, B, C. B and C infect humans and typically cause mild diseases, flu, and things like that. We are with respect to the A factor, that infect animals, which is zoonotic in the nature, and it can infect animals and also humans. So there are basically two surface proteins in this A segment of this bird flu. One is HA, that is called the hemagglutinin. The second is NA, that is neuraminidase. So there are more than 15 strains as far as this influenza is concerned. Mostly popular types are H5N1. Anil sir talked about. It causes infection into humans as well. Then H5N8 is mostly that has been observed in India in the recent case. That is not that serious a case. So H5N1 is highly pathogenic avian influenza. We are worried for that, and it is especially deadly for this poultry industry. Anil sir talked about the economic impact of bird flu in our country. As far as impact prevention and eradication is concerned, it may lead to devastating consequences to the poultry industry in our country. More than 50% of the population that gets affected in general in these kinds of industry. And the protection, if you talk about the strict biosecurity measures that has to be taken care of, and good hygiene has to be maintained as far as protection is concerned. Then policy of culling, that is from the animal inclusive disaster risk reduction point of view, this is very, very worrisome. I mean, this is very pathetic news to hear these kinds of situations. Like 400 ducks, they have been culled in Sanjay Lake, and more than 1.66 lakhs this poultry they have been ordered to be culled in Haryana state. So, but still, this policy of culling is the main policy with respect to those areas where huge infections are there, so that this can be prevented. So if you talk about the World Organization for Animal Health, that is OIE, this is the main organization which declares any country or a state with respect to whether this is free from avian influenza or not. I remember in year 2016, we got this status. We were notified as a country which is free from H5N1. Again, 19, we got this status, but this status remains till that time when another outbreak is again reported. So we are into 2021. This bird flu has already arrived in our country. So by the time we will eradicate this influenza, then only we will get another status report from OIE with respect to our country to declare ourselves free from avian influenza. If we talk about the genesis of this disease, this was first reported in geese in China in 1996. Thereafter, several outbreaks with respect to other countries periodically. As far as India is concerned, we had this in 2006. It started in Nandurbar in Maharashtra, which led to large-scale culling of poultry birds. As far as present status is concerned, present bird flu status is concerned, the samples of Rajasthan, Madhya Pradesh, and Kerala, they have tested for H5N8, and Himachal Pradesh, these reports, they are tested for H5N1 strain. H5N1 strain can jump species and infect humans from the infected bird also. The first case we had in Hong Kong in 1997, where a poultry farm worker caught this infection from the infected birds. problem area why we are worried with respect to bird flu is high mortality rate with respect to H5N1. It is almost 60%. If you compare this with the current pandemic, this mortality rate never crossed 3-4%. So with respect to that, the chances of infection to humans is though less, but as far as mortality rate is concerned, is more than 60%. So that is the area of concern. In its present form, the human-to-human infection is not known, but human infections have been reported only among people who directly handle these birds or poultry that are infected with respect to this bird flu. So we have to protect ourselves from those angles. As regards this period of 2006 and 18, when we started having these kinds of cases in our country, we started with Maharashtra in 2006, and in these times, we have reported 225 epicenters of bird flu, and we ordered culling of 83.49 lakh birds, and compensation to the tune of 26.37 crore were given to the farmers. But interesting fact is, it started though from Maharashtra in 2006, but thereafter Maharashtra did not have any such kinds of incidences. But rather, Odisha, Tripura, and West Bengal were three important states which had recurring examples of bird flu outbreaks in this time zone. In the present time, most infections have been from the wild birds, crows, and migratory birds. Since 2006, the poultry industry have developed the biosafety zone kind of things, where what they do, these commercially reared birds, they are kept away from coming to contact to any kinds of foreign feed, any kinds of foreign birds, so that they can be saved from having this kind of influenza. As far as poultry meat and eggs, that is worrisome area. Professor Anil talked about economic impact. We consume as a country 30 crore poultry birds and 900 crore eggs per month. The chances of H5N1 virus infecting humans is comparatively low if we compare our country with respect to South Asian countries because of our culinary habits. Mostly when we cook our poultry meat and eggs, then temperature is always 100 degrees Celsius. And what is said, even WHO confirms it, that this H5N1, this can't remain alive beyond 70 degrees Celsius. So that way, India is rather in safe zone. As far as COVID-19 is concerned, you remember some unsubstantiated rumors when it started pandemic that this has connections with chicken and eggs. This poultry industry gone down like anything. We had losses to the tune of $1 billion US. Though this industry managed to get back on its feet in a later phase, but again, this bird flu dangers have threatened the future economy with respect to poultry industry in our country. Even WHO says that it is safe to eat poultry meat if it is properly prepared and cooked because of that 70 degree that norm. As a standard precaution, it has issued guidelines recently that poultry products and wild game birds should always be prepared following good hygienic practices, and also poultry meat should be properly cooked. As far as spread of infection in humans is concerned, the cases have mostly been linked to home slaughter and subsequent handling of diseased or dead birds prior to cooking. So in those areas, these poultry meat shops and other areas, even at home, if we bring birds and we cook, we do the slaughter thing, then we have to be cautious with respect to infection issues with respect to bird flu. As far as symptoms are concerned, normal, that very high temperature or feeling hot or shivery kind of situation you might feel if you get infected, then itching of muscles and headaches and coughs. Then there are reports of some patients having diarrhea and sickness and stomach pain, chest pain, bleeding from the nose and gums and conjunctivitis. Professor Anil rightly said, if it goes more severe, then cases of pneumonia and acute respiratory distress syndrome can occur in patients. It usually takes 3 to 5 days for the first symptoms to appear after infection. So based on your situation, as it is done in this pandemic, doctors might suggest home quarantine or hospitalization. And the early diagnosis, if it is done, then proper treatment, antiviral medicine can be given to you. Then it may prevent complications and reduce the risk of developing severe illnesses and improve chances of survival. Basically, this diagram, photograph you are seeing, Tamiflu that is given, and Janamivir kind of medicine. These two antiviral medicines are given to treat this avian influenza. Now, those are infected with avian influenza. Now, what we can do to precaution is better than cure. It is always known we have to wash our hands more often with warm water and soap. That is already being done with respect to this pandemic, especially before and after handling of food, in particular raw poultry. We have to use different utensils for cooked and raw meat. We have to make sure that meat is cooked until it's steaming hot, so that 70-degree temperature zone is crossed. And we have to avoid contact with respect to live birds and poultry. This is the negative is that definitely we have not to do. We have to make sure that we don't eat raw eggs. We don't go near or touch bird droppings or sick or dead birds. We have to make sure that we don't go to live animal markets or poultry farms. We should not bring any live birds or poultry at home, including feeders even. We should not eat undercooked or raw poultry or duck. So we should remember one thing, that there is no bird flu vaccine as such. Seasonal flu vaccine does not protect against bird flu. This is my last slide. Basically, short-term measures, instead of going for short-term measures, we should go for long-term measures. We all know that we are going through climate change. Recently, I gone through one interview of one glacial scientist. He said that because of the climate change, once glaciers are going to melt, then lots of pathogens, they are coming to the open. They are going to come to the open, and we are worried only with respect to corona. There will be millions and millions of such pathogens in times to come. So we should be very careful with respect to that. Pandemic has definitely taught us many lessons with respect to what should be new definitions of growth and development. We should not be more greedy. We should be only needy. We should learn to live with less. It is multi-hazard time, like Professor Gupta rightly said, that one aspect of time and one aspect of one local, geographical local, can be bombarded with respect to many kinds of disasters at a time. So multi-stakeholder approach has to be adopted. We have to learn to live with animals. That coexistence has to be there for sustainable development. We should not encroach into animal habitats. If they get each and everything in their habitat, they are also not going to come out to our own habitats. We have to save forests. We have to limit our food habits. We should not try for exotic foods in the name of new experiences, so that we can save ourselves from pathogen or this virus attacks. We have to learn to live with less, and the kind of hygiene maintenance we are observing, the kind of Ayurveda and yoga, the pranayama and things like things that we are observing in the times of pandemic, we should continue doing that. Production is better than cure, and we should save our natural resources. That there is concept of Earth Overshoot Day. So it says that the natural resources, that is, Earth has the capacity of regenerating in a particular year. We are crossing that limit, and in the last year, 2018, this day fell upon on September 1st. It means by September 1st, we had consumed the natural resources that Earth had the capacity to regenerate. So we should observe these things and try to save birds and animals. Then probably we will be moving towards a disaster resilient society in times to come. So thank you so much.
Thank you so much, Panda sir, for your nice and excellent presentation on bird flu. Thank you very much. Now moving ahead to our next session of this webinar, I invite Professor KML Pathak sir, who is the former Deputy Director General Animal Sciences, ICAR New Delhi, and former Vice Chancellor DUVASU Mathura. After his brief introduction. Professor KML Pathak sir is a veterinary and animal scientist of national and international repute, with more than 39 years of working experience in institutes in India and abroad, covering different livestock species. He obtained postdoc in animal biotechnology from University of Salford, United Kingdom. He distinguishably served as Deputy Director General AS Indian Council of Agriculture Research, Vice Chancellor DUVASU Mathura, and Director National Research Center on Camel. He has got one patent, authored more than 132 publications, 7 books, and 3 book chapters. He is recipient of several awards and honors, including Doctor of Science honors from 2 prestigious veterinary universities, Lifetime Achievements Award, ICAR Gold Medal, Distinguished Veterinarian Award, Agriculture Leadership Award, and Best University Teacher Award. Over to you, sir. And I am sharing a presentation. 1 minute, sir. Is it visible, sir? On full screen.
Yes, yes, yes. Make it full screen. Okay.
Is it in full screen, sir?
Yes, 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 yes.
Now,
It's okay.
now you can see.
Yeah, thank you, Harshit, and good morning, everybody. Professor Gupta and faculty of NIDM, all esteemed panelists and all esteemed viewers and participants. First of all, thank you, Professor Gupta ji, for giving me this opportunity to participate in this important and timely webinar, and also to the faculty of NIDM for the thinking about the multidisciplinary approach in organization of the webinar on bird flu. I also want to congratulate Professor Gupta for his introduction, and I think I really enjoyed the presentation of Dr. Panda, who has very effectively
मैं म्यूट कैसे करूं यार इसकी?
हर्षित अनम्यूट कर दीजिए सर को प्लीज.
I'm sorry. Yes, yes. So thank you, Professor. I think you could not hear my earlier view. So thank you very much, Professor Gupta ji, for inviting me to this important seminar, and also to the faculty of NIDM for thinking to organize an important and a timely webinar, a multidisciplinary webinar to address the bird flu, which is really our 9 states of our country. They are facing this problem, and I really enjoyed the presentation of Dr. Panda, who introduced the subject, and he gave a very holistic presentation about the bird flu. So I will not go in the detail about the biology of this virus infection, but as has been given to me about to speak on the risk and response, so I will be restricted mainly to that, but with a little bit introduction of the bird flu. Next, please. As we are discussing today, bird flu, which is also called avian flu or avian influenza, it is caused by avian influenza A type virus, as mentioned by Dr. Panda. And as it is known as, it is a bird flu virus, primarily affect the wild and domesticated birds, and do not normally infect human, but several cases of human have been reported after since 1997. And in India, there is no evidence of human bird flu or human to human transmission so far. As we all know that the wild aquatic birds, particularly the ducks and geese, they are the reservoir, and this virus it doesn't cause any disease in this in these birds. But migratory birds, we in India we get this infection every year. The first outbreak of bird flu we got in 2006. After that, every year during these winter days, these migratory birds had the tendency to migrate in Asia or India in the month of September, October, November, December, and they bring this virus from these wild aquatic birds. And our wild birds like crows, pigeons, and parrots, they are infected, and from there, our domestic birds and turkeys, they get infection. We all know that the infected birds, they discharge the virus in their saliva, nasal discharge, and dropping. So this point is very important, that we all should know that how this virus is discharged or by these birds in the environment. As we know that avian influenza strain, there are two avian influenza strain. One is highly pathogenic avian influenza and low pathogenic avian influenza. This is based on their pathogenicity they cause. Low pathogenicity avian influenza viruses, they are found in these birds, in the wild birds, and they don't cause any disease, as I mentioned. And also in some of the birds, in domestic birds, they also cause some little bit disease like ruffled feathers and drop in the egg production. Otherwise, they don't cause any mortality. So this low pathogenic avian influenza is no much concern for us. Highly pathogenic avian influenza. Next, please. Highly pathogenic avian influenza, commonly known as bird flu, has been recognized as a highly lethal generalized viral disease of the poultry since 1901. And this highly pathogenic influenza, it is a zoonotic potential, means it is transmitted from birds to human, as said by Dr. Panda also. And it causes many type of the economic disturbances and economic losses to the farmers also. And World Organization, that is OIE, has already made it mandatory for every country to notify the highly pathogenic influenza viruses. And we, India, we are following the guidelines of the OIE. And every year we report that this virus has occurred in our country. The highly pathogenic avian influenza causes both direct and indirect causes losses, as rightly mentioned by Professor Gupta ji, that the direct losses, it is really very high. Direct losses include loss due to the high morbidity and mortality, loss of vulnerable genetic material. Every time whenever there is a outbreak and we do culling of large number of the birds, we lose valuable genetic material. Cost of depopulation and disposal, cost of quarantine and surveillance, and compensation for the eliminating the live birds. Indirect losses are due to imposition of trade embargo, as mentioned by Dr. Panda as well as Dr. Gupta. This aspect, the people, because the poultry, in another slide I will show that how the people in our country, they are dependent for their livelihood and for their resources on the poultry. This trade is really affected very much. And in the introductory slides, Dr. Panda also mentioned that in Delhi and NCR and other places, the poultry market has been closed. Next, please. This is the species of even this affecting influenza. You can see that how the species, they are intermixing, and the strain H12 and H1415, H1427. So these wild ducks and geese, they are the source of infection. How the infection goes to birds, from birds to how it goes to human being, which are the strains, and what are the different species which are affected by influenza. Next, please. Now, if we look to the epidemiological status of highly pathogenic avian influenza, then you see that highly pathogenic notified avian influenza, the ghost population of Guangdong, China in 1996, it was reported. Later on, Hong Kong in 1997, the first case of human influenza, highly pathogenic influenza, was reported in 1997. Now, the reemergence of the high pathogenic avian H5N1, it was re-emerged in 2003 and 4 and spread from Asia to Europe and Africa, caused several hundred humans died due to this, and millions of the birds, they were killed or culled. Acidic form of the H5N1 is triggered, and it is a concern for all of us, and it remains always under close surveillance due to its feared pandemic in human being. Entry of highly pathogenic H5N1 in India, as I mentioned earlier also, this virus was first time reported in India 2006. After that, every year during the winter season, we are facing the same problem, and it started in Maharashtra, Gujarat, Madhya Pradesh. And since then, it has the H5N1 has been reported, as well as other strains like H5N8 has recently has been reported. And thanks to the preventive measures and the strategy of the government, that we are able to control or contaminate this virus in the states. And next, please. Highly pathogenic avian influenza outbreaks, if you look, though it was also mentioned by Dr. Panda, that total outbreaks and what are the states and what are the subtypes involved in bird flu, that is H5N1 and H5N8. And by this, you can see the how the different state, and since 2006, as I mentioned, until 2020, how many cases have been reported in the different states of the country. Next, please. These are the year and states and subtype and the bird species. So if you look that the subtype, mostly the H5N8 in 2017-18, but in every year we got the outbreak of H5N1. And this confirmation of the subtype of the outbreak, it is done by our ICR laboratory in Bhopal, which I always rate as one of the best laboratory. And for avian influenza, you will be happy to know that we have been recognized by OIE and WHO as one of the best diagnostic facility in the world. So these are the different species of the birds which are affected with the H5N1 and H5N8. Next, please. Now, what is this? This here I would like to concentrate more because this is the main theme of my presentation. What are the basic principles of the bird flu control? Now, the disease control and preventive, they have the three goals, and this slide may be of interest to the faculty of NIDM. The first thing is find it fast, kill it quickly, and stop its spreading. All three goals are equally important. You can't say that first one is more important or third one is important, but all three, they are important and all must be achieved efficiently. Three basic components of the disease control. You name any, even we follow the same in other diseases, except we don't follow the kill it quickly. But in Corona also, we did so much surveillance also, and we could get control on that. Surveillance and culling are the most reactive. So if we call what are the reactives, so surveillance and culling, they are the most reactive methods in the surveillance finds disease once it has occurred, and culling responds to this. Vaccination, as we have vaccine, for our institute, some of the institute, they have developed the vaccine against avian influenza, but there are many technical and policy reasons that make it difficult to implement developing countries. Some of our scientists, they advocate that yes, we should go for the vaccination against avian influenza, but some of them, technically and policy, there is a issue. So that's why we don't go for vaccination. Biosecurity is preventive and gives keepers to tool they may need to protect their own birds, and it is proactive and enabling. So biosecurity and biosafety, they are the very important in controlling this bird flu infection. Biosecurity, if I talk about in detail about the biosecurity, so this has three objectives: to prevent the entry of the disease. First is that prevent the entry of the disease, control spread of the disease, and prevent infection to human beings. So these are the three basic objectives of the biosecurity, which has to be followed by the poultry workers and the policy makers also. Next, please. Now, these you will be happy that yes, NIDM also involved in these in disaster management, and that's why I always give salute to the faculty of NIDM and Professor Gupta also. That whenever there is any disaster, and you rightly, Professor Gupta, you rightly mentioned that now the usual disasters are not happening, but in addition to that, new disaster like environment and health disaster, they are happening every year. And to address these disasters, to control these disasters, Government of India, Department of Animal Husbandry, they have prepared an action plan, prepared control and contaminate of avian influenza, and they are advising the government, central government is advising as per this plan. This plan, which was first made in March 2015 when I was also there in the ministry. And this plan, they have a four chapters. Chapter 1, advise the states and unitary to preparedness against the AI outbreaks. Chapter 2, indicate the action to be taken, what action has to be taken when the outbreak is there. Then describe the action during the outbreak of the disease. And fourth chapter, it covers the identify a person who will handle avian influenza, infected poultry, and advise on biosecurity and safety measures. Now, these action plan, they are every year they revise, and now the latest action plan by Department of Animal Husbandry, it is available on their website. So any person who is involved in the control of this avian influenza, they should go to this plan, and we have to be adhere to this action plan proposed by Government of India. Next, please. Next, please.
Is it moving?
Yeah. Move to another slide.
Harshit.
Yes.
Yes,
Now,
yes,
as mentioned by Professor Gupta as well as Dr. Panda, that the most important part, because we are lucky that in India we don't have got any human infection from avian influenza or bird flu, but it is definitely it is having a huge economic impact on our poultry industry. And the livelihood of so many people, it depends on the more than 3.5 crore farmers. They are engaged in that, in this poultry industry. And you know that India export processed poultry products such as egg powder, egg yolk powder, and chicken products worth 100 crores of every year. There is a just correction that this is 330 chicken and 900 crore eggs. So you please make one correction. And you know that nowadays, for the last 10 days, as a scientist, as a resident of India, as a human being, I am watching that the people are, so they are proposing, so their hypothesis, there are so many rumors, they are being circulated myth about this bird flu. And the same thing as mentioned by Professor Gupta also, that when in March 2020, when this corona came at that time, so many stories they were circulated in the social media, and large number of the poultry, the people stopped eating the chicken and egg. And at that time there was a myth that if you eat poultry or chicken or egg, you will get corona. So these things again happening this year also. And that's why I congratulate again Dr. Gupta, Professor Gupta, for organizing such important webinar. And there should be more awareness program, because now this infection is till morning 9 states they got this infection. And there are people are spreading rumors, and it is really adversely affecting our poultry industry. And it is causing huge economic loss to the poultry industry and poultry farmer due to current flu. So it is not so the most important message through my this presentation is that we have to stop or not to spread rumors about the bird flu. Yes, it is H5N1 can infect human being. Yes, this is a zoonotic disease. It is truth that it is a zoonotic disease. But fortunately, in our country, we have not. So we have to be careful. We don't have to be in panic, but we have to be careful. We have to follow all the precautionary measures to stop the transmission of this infection. Next, please. Now, this is my last slide. As I mentioned that the awareness about the bird flu, how bird flu is spread to the poultry, what are the species which are infected, and how we can. Now the people are asking me that, Dr. Pathak, when you say that this is a zoonotic infection, then there is a risk. Yes, I say yes, there is a risk. But if we follow the biosecurity and biosafety measures, then the risk is not there. If you eat the properly cooked poultry, if you eat the properly cooked egg, boiled egg, don't eat a half boiled egg or any eggs. So if you take all these precautions, definitely you will not get any bird flu infection. So avian influenza is a disease that is highly susceptible to the application of biosecurity measures. I am again giving more emphasis on the biosecurity measures. It is highly dependent on the actions of the people for its spread. Emphasis should be placed on biosecurity, which has a proactive preventive interest. So what the biosecurity do? They help in the preventive impact. They have a preventive impact. Biosecurity plan should be a part of any poultry production system. Either you talk about the backyard poultry or commercial poultry, but in both places, if I have a 10 birds, if I have a 10,000 birds, 10 lakhs birds, then I have to follow the biosecurity and biosafety measures. And the people who are visiting the market, people who are visiting the live bird market, people who are visiting the murga market like that, and the people who are involved in the trade, in this trade, they should strictly follow the biosecurity and personal hygiene. Means they have to wear the gloves, they have to wear the face mask as we are doing in the corona infection. So same personal hygiene is required in this infection. And I always say that it is safe to consume poultry products that are properly cooked over 70 degrees Celsius, because over 70 degrees Celsius bird flu virus it is killed. And so in the final words, I can say that bird flu is a avian virus. It is not a human virus, but it can be transmitted to human if we don't follow the biosecurity and biosafety measures. So proper education, proper awareness program, continuous proper awareness program is required, and I congratulate the central government. I congratulate the Department of Animal Husbandry for their action plan, which they have made, and it has been circulated. And now the central government, in consultation with the state government, is trying to stop this infection to spread in other states. So that I have to say. I think I have, Harshit, I have not taken much time, but in short, I have tried to summarize what we required as scientists and what the people is supposed to know about the bird flu. Thank you. Thank you very much.
Thank you very much, Pathak sir, for sharing your thoughts with our participants and for your nice and interesting presentation on bird flu. Now, moving ahead to our next session, I invite Dr. Ramchandra Kamath sir, who is the professor and head Department of Community Medicine, Kodagu Institute of Medical Sciences, Karnataka, after his brief introduction. Dr. R. Kamath sir is the professor and head Kodagu Institute of Medical Sciences, Karnataka. He had done his MBBS and MD from Kasturba Medical College, Mangalore University and Manipal University respectively. His honors are Deputy Controller of Examinations, Manipal University, Distinguished Alumni Award by Kasturba Medical College, Manipal. Fogarty International Center, National Institutes of Health has awarded him a scholarship to attend smallpox eradication symposium at Rio de Janeiro from August 24 to 27, 2010. He has been awarded the District Karnataka Rajyotsav Award in the field of public health and disaster management. He is actively involved in emergency medical relief activities jointly with UNICEF, Association of Medical Doctors of Asia, AMDA, Japan, and Indian Red Cross Society. He has also carried out many rapid assessments on health situations and health care needs, disaster management, field operation planning, and trained public and private healthcare professionals on public health emergencies. He has total 32 publications and has completed various research projects. Over to you, sir.
Okay. Harshit, can I share my slides?
Yes, sir. Yes, sir. 1 minute. Yes, sir. Now you can see, sir.
Yeah.
1 minute, I think. Yes, sir.
Yeah. Okay. Very good afternoon, respected Professor Anil sir, all the speakers.
Sir, make it on full screen, sir.
Yeah. Okay.
Thank you, sir.
Yeah. Okay. Yeah. Very good afternoon, Professor Anil sir, all the speakers, all the participants, and thank you, Harshit, for the nice introduction. As earlier speakers already mentioned about this bird flu epidemic, always there is a question public, there is always a panic and a fear, and always people ask, how can I protect myself, how can I protect my family, how can I protect my community? I think this is the very common scene maybe in another few months. So I thank Professor Anil sir for the opportunity. Hope I can contribute in this webinar. Okay, I'll be talking more about prevention and control. As said by earlier speakers, okay, so nothing to get any fear or anything, because this virus has high pathogenic in nature, I know, and which has epidemic and pandemic potential, and which causes high mortality among the birds. But as of now, we don't have any cases. There is no evidence of any human transmission. And only thing is we don't have that inbuilt immunity for H5N1. But we have to be very cautious, and we have to be very careful, and we have to be fully prepared. Okay, so I think here in this epidemics of all these zoonotic diseases, we have enough time. All the action plans everything is ready. As speaker said, there is always a panic situation everywhere, and wrong messages are spread throughout the country. If you see this epidemic, there is only the one particular group. Yes, I think the entire general population is they are safe. Only the high-risk groups are those who are working in the poultry. It may be the small scale or large scale, or those who are involved in the killing of birds, or persons working in the wet market. And consumption of meat and egg. Okay, so as speaker said, okay, so I think absolutely no problem with well-cooked food. Okay, so and it is highly sensitive, heat-sensitive virus, and all the virus will be killed by 70 degree. And I think people are scared, even for speaker said Corona also. They thought, and all the fish markets were closed, and all the poultries were closed, and they thought it will spread by chicken and egg and fish. Okay, so I think that was a wrong concept. And healthcare workers, anyway, I think they will be involved in the initial epidemics. So they will be assisting. Okay, so they will be handling symptomatic and asymptomatic cases. For any epidemic, I think first step is notification. So here, any suspected case, so I think immediately should be notified to the authorities. If there's any report of any dead or diseases of wildlife or animals or birds, so should be reported immediately, so that action can be started immediately. And the second is quarantine. I think people are well aware now. Quarantine, they are very much clear now. Okay, so what is the importance of quarantine? It may be the home quarantine or quarantine in some facilities. So all the suspect human cases or animals, okay, so or birds, okay, so should be quarantined for a short period of time, because we know the incubation period, it is only the 5 to 7 days. And people who are working with the infected group, infected poultry, so here they have to follow all the basic steps. I think we learned a lot, sanitation, hygiene, all this thing in the Corona. So things in the similar way here also, people working in the infected poultry, so they have to follow the good hygienic practices. Make sure without the PPE, don't enter any high risk zones. Okay, so if I'm working in a poultry, okay, so, or my worker, okay, so I think everybody should be very clear. Okay, so don't enter without PPE into this hotspots, and when there is a suspicion of epidemics. And we can consider some of the antiviral drugs, maybe for prophylactic or therapeutic. As sir said, Tamiflu, I think one of the safest drugs. And vaccine against human influenza. So as we don't have vaccine for H5N1, but other species H1N1 vaccine is available. But here problem is this virus is highly mutant. Okay, and that is why I think there is always a query regarding the vaccination. And for the public, very clear. Okay, so please don't go to any domesticated poultry. Please avoid that. And visiting poultry farms, visiting zoos. Anyway, zoos, all this will be closed. And don't handle any live birds. Okay, so don't. I think even the people working in the pet markets, I think everybody should follow the steps. In the hospital, if we get any symptomatic or suspected case, okay, so all the healthcare workers will follow the standard protocol. So hand washing with the soap and water, and they will be having PPE. It may be starting from the entire PPE kit, or maybe the goggles, gloves, okay, so and other PPE kits. And it is every hospital, every district, they should have they should be prepared, and they should have a separate ward kept ready for isolation of influenza cases. And once the patient discharged, entire patient into that room and clothing, everything should be disinfected. We have so many disinfected now, sodium hypochlorite, potassium permanganate, fumigation. So many disinfectant agents are available. So many methods are available nowadays. So, and we can use that. And prevention, as I said, first step is you notify. So
Harshit, I think the audio has gone.
Yes, sir. Yes, sir. I am trying, sir. I am checking.
Thank
I think there is some technical problem. I am checking, sir. I am trying to call him.
large scale production was just required. And the food security, I think, is very clear. Okay, so I know it is highly heat sensitive virus, and if they have good cooking practices and cook chicken and egg thoroughly at 70 degrees centigrade, I think the entire whole food item is safe, and food handlers also use good hygiene practices. And for the pandemic precautions, I think every every citizen in the country should know. Okay, so what to do and what not to do. So avoid all the crowded condition and avoid close contact. So this anyway we learned a lot from this corona issues, and everybody is aware now. Okay, so what are the PPEs are available and how to use it, and hand hygiene measures. Okay, so I think it is now people are using it and it's almost 100%, and practice social distancing. I know it's a developing country like India. Social distancing is a little difficult. Yes, and because we always work in a crowd, we always with the crowd. So social distancing, I know it is a little difficult, but as a norm, we have to practice it. And quarantine, as I said, the quarantine for animals or quarantine for birds. But I don't know for the small scale poultry whether they have separate area for this. So this may be the one of the issue in the rural areas. So quarantine even the symptomatic cases. So drugs are available. So we have M2 inhibitors, we have neuraminidase inhibitors. So Tamiflu we can be used for both prophylactic and also as a therapeutic. And it's a safe drug, and we have used during H1N1 epidemic. So vaccine we don't have for H5N1, but anyway H1N1 we have vaccine. In the US also, I think they are using this international injectable vaccine. Many Middle East countries they use this, but we don't have that species specific vaccine right now. And we should have a very strong surveillance system. Okay, so at the district level, and it should percolate to the rural areas. And both, I think, multi-sectoral approach is very important in this issue. Agricultural department and animal husbandry, health. So everybody should work in a very coordinated way. Then only I think entire district maybe having the very good preparedness plan. And here, as earlier, I think the speaker said, there is a lot of fear and phobia. I think social media, especially print and electronic media. So I hope they will give only the scientific information. Okay, so I think in the current digital era, we call it WhatsApp University. I don't think so. This WhatsApp University not really confuses everybody. What we require is scientific information and give clear messages, what is do's and don'ts. And I don't think so there is any panic situation, but only thing is get ready, be prepared, and protect animals, protect birds, protect human beings. Because I know there is a species jump, so from the birds, pigs, animals to human beings. And human beings, if they take care, okay, so as I said, some of the methods, if they follow, definitely we can completely get protection. Okay, so and hope entire population in the country. Okay, so they are fully aware, they are fully protected, and absolutely there may not be any panic situation in the country. Okay, thank you very much.
Thank you very much, sir. Thank you very much for very informative session and your presentation. Thank you very much. And now moving ahead to our next and the last technical session of today's webinar, I would like to invite Dr. Sekhar Lukosa, who is the Member Secretary of Kerala State Disaster Management Authority and has Scientist State Emergency Operations Center after his brief introduction. Dr. Sekhar has completed his MSc in Applied Geography from University of Madras. From August 2001 to March 2003, he was employed as a consultant GIS for Parambiculam Wildlife Sanctuary, Department of Forest and Wildlife, Government of Kerala. He was also consultant GIS for Enter Technologies Private Limited. Further, he was employed as management plan and GIS specialist, Gulf of Mannar Marine National Park, Department of Forest and Wildlife, Government of Tamil Nadu. He had been appointed in the Government of India UNDP Disaster Risk Reduction Program as head HVRA cell in 2011. He has several peer-reviewed international journal publications, one CD-ROM, 2 websites, 2 postgraduate research theses, several governmental reports, etc. Currently, he is the member secretary to KSDMA. Over to you, sir.
Thank you, Professor Anil and my colleagues here. As far as I'm getting into the subject directly, from a governance perspective, it was in 2013 that Kerala experienced a widespread avian flu spread in our district. I think the host has to mute because I'm getting a lot of background noise from. Can I go ahead? Yeah.
Yes, sir.
Yes. So in 2013, when I was heading the State Emergency Operations Center, we had information coming in from Alleppey district stating that there has been widespread reports of flu and birds are dying, particularly ducks. Alleppey, the Kuttanad backwaters is very famous for duck growing and rearing. And the eggs from this place is very much cherished across the state. So this caused a tremendous pressure on the district administration. They contacted us. We definitely had the national guidelines with us. We had an idea of what has to be done. We have our own community medicine specialist on board. So we discussed in 2013, and at that point of time, well, even now, it's not a notified disaster per se, nationally or in the state, but we decided that Disaster Management Act will be involved. The reason was that, as one of the earlier speakers told, well, it matters a lot to the farmers. It's their livelihood. So when their livelihood was threatened, and a lot of them rear these ducks with a lot of passion for doing this. So they had an emotional attachment to the birds that they were rearing. It's not that they rear it and then kill it on a simple commercial basis. In Kuttanath, the ducks are reared in open. They are taken for days together to feed out in the open by one or two of these farmers. So, and it's a beauty on its own to see these ducks going in flocks across the backwaters, and this also creates an emotional attachment for the farmers to these ducks. So, naturally, they were very much against me doing any culling operations, me doing any sanitizing operations. So the then district collector, Mr. Patnakumar, who is now retired, as rural development commissioner, he stepped in and requested us as to a strategic action plan. So he suggested that we invoke Disaster Management Act and notify this area as an affected area under the DM Act, and then take over these resources. I'm using the words as it is there in the Act, so that it doesn't go against the legal context of it. All the others are academicians, so you would realize that the legality of this also matters a lot, because later, as I narrate, you will hear stories about what happened in the High Court. So we said the resources, which being the ducks and their rearing ground, will be taken over by the district administration, and the ducks will be culled. Now comes the question of what will you pay as compensation. So SDRF has no direct provision to pay off. The government of India stepped in and said we will give some assistance. Nevertheless, by the invoking of Disaster Management Act, the farmers, their revolting nature subsided. They yielded to it. They realized that they will have to challenge it in the High Court, which, of course, these poor farmers can't do. They are not very rich, well-to-do farmers, so they resisted, or they desisted from actually going to the court. Interestingly, the culling operations went well. Further spread from more than 4 panchayats were restrained. Now, as we speak, it's in 8 panchayats spread across 2 districts, Alampi and Kottayam. But it is contained there as of now, so we are not seeing anything spread to other places. Having said that, later comes the more interesting legislative or the judicial story of it. A couple of farmers came together and said that this assistance that they got was insufficient, which of course we all will agree that a duck will fetch not less than 1,000 rupees in terms of duck, in terms of eggs, as well as the meat at the end of its time to be culled. And having said that, these farmers were paid roughly about 11 rupees, which is peanut money. It's not even an input subsidy for them to start back, because a lot of their cages were destroyed, burned. They had to do everything from scratch to get a flock of birds again. So they went to the High Court. We went to the High Court, and then a lot of litigation happened. And finally, High Court did rule in favor of the state, because we went, as in the book, in the Disaster Management Act, to identify the threatening disaster situation and take over the resources and react to it. But when that's from the official seat of me that I was talking about only one case. But at the end of the story, I'm also a human being who also looks at farmers and see the farming community on a daily basis. We have lots of friends who are from the farming community, and this is one issue that I will flag here. But when such influenza happens and the mass number of birds gets culled, yes, we all speak about how we contain it by culling them, by restricting movement of goods, but we don't speak about how do we revive the livelihood. That is something that we have to think more seriously, because the 200 rupees is nothing for the farmers to start back again. So I think there has to be, and now that SDRMF has come in, a concept of insurance for these kind of farmers who are repeatedly being subjected to this situation may be thought about. Anil sir can think about it in the insurance working group. But I think from a farmer's perspective, the input subsidy has to be substantial enough so that the farmer is not out of the streets. And we are talking about small scale farmers who rear 1,000 ducks or 1,000 ducks, and they can't start back with little money that we give. So this is a concern that we have. Second aspect of administrating disaster risk reduction from this perspective is the right availability of resources. Now we are lucky, in fact, because we have a lot of PPE kits in stock for the COVID, and we have a lot of other chemicals that are required to tackle the scenario in stock. The reason being that we are in a COVID time and the PPE kits are large in number. It is available to animal husbandry department as well for readily accessing it. But in the normal times, if things were very normal, we wouldn't find these stocks pretty much available everywhere. And if we had stocked some of them, after a year, the PPE kits, they are folded and kept. Now, along the fold, they start disintegrating. And after a year or two, they don't have a shelf life enough for to be used again. Because you can't stock them in air-conditioned environment. I mean, we are in India, so we stock it in an almara or somewhere, but then after a year or so, you find that wherever the lines of folding are there are punctures. And this happens naturally. So you need to find a fresh stock. Where do you go for that stock? So that's where I think in the National Disaster Response Reserve, we have to also think of having the chemicals and response gear required for avian flu pandemic control listed out as some of the items so that the NDRF stocks it and makes it available from the NDRR to the states when situations arise. If you ask states to manage such a large stock, maybe most states will hesitate because it's once in a year or once in 2 years or 3 years, and then the numbers are not large, so they will take it as a secondary priority to begin with. But if we are looking at having this readily available, the National Disaster Response Reserve should consider stocking necessary items that would be available for the states readily to pick up and utilize. So this is another loud thought that I'm making here, so that our response time to these actually reduces. In Kerala, in 2016, we started with a novel concept called virtual cadre for disaster management. In every department, we have 15 members who we call as champions of disaster management in the respective departments. So we train them intensively and focused. Animal husbandry also has 15 doctors who we have trained just last year on preparing their own disaster response plans. We also created a sub-head of account in State Disaster Response Fund to ensure that there is some fund flow mechanism wherein this department can tackle the funds, take that in and provide relief or respond to situations. This got institutionalized between 2016 to 18. And that's paving way because there has been at-length discussions with this department and the officials of the department to understand their problems and make things non-ad hoc by listing it out into a DM plan. They had prepared a basic disaster management plan which they would use to respond to general situations, and that actually worked out. One another major initiative that Disaster Management Authority had prepared long back in 2012-13 when Kerala faced a historic 100-year drought was that we insisted that animal husbandry department has a complete digital database of farmers who are into animal husbandry sector. So when there is a relief assistance payment to be done, the money goes from SDRF to the animal husbandry director, and the money flows seamlessly to these farmers who are listed out as affected. So the ace of doing providing relief to the farmers is substantial. Yet another novel initiative that we had done, and that also had provided some seed funds for these farmers in 2019 to revive. 2018 post floods, when Kerala had gigantic historic floods, we started a support mechanism for MSMEs. Anil sir and others who are familiar with the disaster management portfolio knows the norms don't have any revival assistance schemes for MSME sector in the SGRF. So we created a scheme in the state. It was called Ujjivana loan scheme. Ujjivana means to revive. And we gave out 2 lakh rupees a subsidy to loans amounting to 10 lakhs for MSME sector. And we particularly insisted that this loan scheme will be available to poultry farmers and animal husbandry sector farmers. So as we speak, until 2020 August, we had the scheme running. Until that time, we have roughly about 58 crores of rupees, which went to these farmers to revitalize and begin again. We also have covered people who rear decorative birds and also aquarium fishes. So this scheme had given them a backing to revive, but now in Alleppey and Kottayam, this avian flu would have hit them badly, and we need to see how it can be revived. And I think in 2018 our situation was different. We had enormous benevolent assistance from all of you across the world to revive back. So the state government could think of such novel ideas. But now, and with 10 states affected, I think the government of India has to think of a scheme where we provide some solid input subsidy for these farmers to begin their processes back, their farming back. We also have to realize that a lot of these farmers not only rear birds, but they also have domestic animals. They rear them in the family ponds or the neighboring paddy land in Kuttanad belt. Now, as we were talking in some of the previous lectures, there is a lot of social stigma about it. Now, the moment avian flu was seen in newspapers, even in Trivandrum, people stopped consuming poultry meat and eggs. Trivandrum is 200 kilometers away from the furthest distance to the south from where the avian flu has reached. Still, people don't want to take eggs. People don't want to use poultry because they are afraid that this is going to come and affect you. Large amount of meat used to be consumed for domestic dogs. In Kerala, that our KEPCO has a dog meat counter separately where they sell poultry for dogs. Even people whom I know, including my wife, decided that she won't buy poultry for her dog anymore. So this is how people have come up with a stigma. And every time when such a stigma strikes, I have seen that it takes ages before it revives. It takes months together. So even if the production is revived, we are looking at a cold period where there won't be much of consumption in the society for the fear of avian influenza. So we need to think of how we support these people, their livelihood during that black period, the cold period where the society still holds a stigma towards consuming poultry. When we speak about spreading to humans, we have not come across such a case, at least in 2014. And in between, we had a small episode in 18 end, but we didn't see anywhere that it spread into humans. The potential is not overlooked. The health department is in tandem with the animal husbandry department in responding to this. So that is also addressed. Both the departments in their respective DM plans have mentions about avian influenza and the strategy that they follow. We must, as all the previous speakers commented, we are very thankful to Government of India to have a very well-written response plan, an action plan as to how to contain bird flu. that action plan actually helps in pretty good response, because 1, 2, 3 you can just follow. So inclusion as we speak should be the norm here, and that close my words with. I'm thankful that NIDM put this up to discuss. I flagged some of the issues that I think Officer and others can further discuss. It's pretty amazing to see that such issues, as and when they come up, we are promptly taking it up and discussing, rather than giving a discourse of what I know about avian flu, which all the experts have done in the domain. I am looking at an administrative concern that I faced in the last few years when I had been dealing with this issue. With these words, I thank all of you. It was a pleasure to be with all you stalwarts. Thank you.
Thank you very much, Shikhar sir, for your very informative and valuable points regarding the theme of the webinar. Thank you very much once again. Now, I invite Professor Gupta sir for his summary points regarding the webinar. Gupta sir.
Thank you. It was a wonderful discussion today on this theme, and that has actually given us a kind of a systemic understanding that how one small kind of emergency or disaster, how many dimensions it has, and that is the reason it is of concern to the disaster management system also. As the speakers highlighted, they provided a background and also the stock of information about the risk of bird flu, but also provided the kind of a fact check that will help the people, our participants in particular, and the community in general, to protect from the rumors or the kind of panic that is being generated in these 9 states, and not only 9 states, even the neighboring states, because the poultry products are being transported from the nearby areas. So, and then people are traveling also, and 5 kind of a key dimensions which have been touched upon by the speakers. One is that the scientific and health issues. So if we talk of the bird flu as an emergency or as a disaster kind of scenario, as we all agree that if we look at the multiple dimensions of impact on socioeconomic system, on livelihood, on the bird population, on ecotourism, on several other dimensions, and also additional pressure to the governance system also. So that is taking a form of disaster. So besides scientific and health dimensions, which also call for even greater, more systemic study regarding the occurrence of bird flu in India, that what are the actual roots and how it spreads out, and the social preparedness and response, which is very very important, because what we witness that sometimes the rumors and the panic that predominates as the people's mind, as compared to be in a kind of a scientifically designed preparedness and response. So we need to be more scientifically sound. But how this scientific and fact check information can be we can make it reach to the common people in simpler language. So that is also important, because there are a lot of resistance also in people in accepting these facts. And there's a lot of coordination issues which are also emerging, because we are still under the coronavirus pandemic, and this coronavirus pandemic, we have been facing a number of secondary disasters within this period. We face industrial accidents also, we face 3 cyclones also, flooding also, heat also, number of other disasters. So again, this has come and made a new kind of a complex emergency. As people were starting to coming out and starting to visiting the bird sanctuaries and the parks and gardens in our cities, but those are getting closed, and that is creating the impact both ways on the people whose livelihood and economy is associated with these entrepreneurship, but also the people who started going there for the better health and better mental fitness, because the period of 10 months of period of abnormalcy under this coronavirus period also cause a serious level of psychological pressures also. So what in nutshell we can say that the points that has been raised by the speakers today, we can draw upon that an integrated approach. And in fact, otherwise also I am advocating that now probably our planning process for disaster management need to evolve one step further, and one step further should be basically I was discussing with my colleague Mr. Panda my concept of Vishesh, so that how the safety, health, environment, sustainability dimensions need to be woven into one common framework, because now there are a lot of overlap in terms of impacts. Also, there is a lot of overlap in terms of the resources required to deal with these kind of things, and the agencies and departments which are involved. So in general, I can say that the stakeholders who are associated with these. So moving into isolation would probably can lead to a little bit more loss of resources, and integration can help us in looking into more and more co-benefits kind of thing. Shekhar, who shared the real life administrative issues, and also the initiatives that how the state and district administration can be a little more proactive in looking at these situations. So that is of example, but as I already referred, that the social and behavioral dimensions are equally important. So with this, I find that this webinar has been very useful, and I will look forth from Harshit to the key points. He will draw a summary, and we will come out with the key recommendations, which we'll share with all of you also, and with the respective agencies and authorities to take a call on that. So with this, I extend my sincere thanks on behalf of NIDM, on behalf of ED&IDM, on behalf of all my team, to all the learned speakers, and to all the participants who joined this important discussion. So thank you very much, and over to you, Harshit, again.
Thank you very much, Gupta sir, for summarized the webinar, today's webinar. And now, on behalf of NIDM, I thank our Executive Director, Major General Manoj Kumar Bindal sir, for his kind support in organizing these types of webinars and training programs. Professor Anil Kumar Gupta sir for his kind support, and our speakers during the webinar, Professor KML Pathak sir, Dr. R. Kamath sir, Dr. Shekhar sir, and Sri Ashish Kumar Panda sir, and our coordinator Ms. Atisha Sood ma'am, and our esteemed members and the participants for making this webinar successful. I believe that the key points which have been discussed during the webinar regarding the bird flu will definitely help our participants in their day-to-day routine life. And thank you once again all for sparing your valuable time towards organizing this wonderful program. Have a good day. Thanks.
Thank you very much. Thank you very much. Thank you. Thank you.
Thank you, sir.
आपस में अपने सगे तो नहीं चल रहा